I'm going to review my doctor's orders. Have furosemide 80 milligrams, IVP now ordered. Available is furosemide 40 milligrams per 4 milliliters. So 4 milliliters is equal to 40 milligrams, and we need 80 milligrams. So 320 over 40 equals 8 milliliters. So I will draw up 8 milliliters. I'm going to perform hand hygiene, and I'm going to clean off my furosemide bottle. Okay. Okay. Alright, I have 8 milliliters. I'm going to recap using the scoop method. Alright, and label. Lasix or furosemide, 8 milliliters. To check my IV med book for compatibility and time. So furosemide is compatible with normal saline, and I will administer over 1 to 2 minutes. Gather my things and go into the patient's room. My name is Leslie. I'm going to be your student nurse today. Can you state your name and date of birth for me? Alright, we're going to be administering your furosemide over IV push. Going to check your site for patency, which is patent because we have solution running, and check for infiltration, erythema, edema, all of those things. The site looks good. I'm going to wash my hands and don gloves. Since our Lasix is compatible with normal saline, all I will have to do is clamp here. So I'm going to clean the proximal port using friction. Okay. I'll have to remove the needle and then attach the syringe. I'm going to clamp this. And I'm going to push, pause, push, pause, push some more, pause, until I've administered over 2 minutes. And then I can unclamp and dispose of my needle and syringe in a sharps container. We'll continue to assess the site for plevitis, erythema, edema, all of those things. Readjust my flow rate and make sure that the patient is in a comfortable position and that the call bell is within reach. I will document hand hygiene. If the medicine was not compatible, I would have to clamp here and kink, flush first, then administer the medication over however long it is, and then flush again. If it was just an INT, I would have to attach a flush, aspirate, flush through, then administer the medication over the amount of time that it needed, and flush again. Alrighty. IVPB back. I'm going to review the doctor's orders. We have Zosyn 4.5 grams IV piggyback and 150 milliliters of normal saline to infuse over 5 hours. Drop factors 10 drops per milliliter. The flow rate would be 150 over 4 hours, which is equal to 3.75, which would round up to 38 milliliters per hour. To get drops per minute, we would take 10 drops over 1 milliliter. 150 milliliters is equal to 4 hours. 1 hour is equal to 60 minutes. So we would get 1500 over 240, which would equal out to be 6.25, 6 drops per minute. Okay, I'm going to perform hand hygiene. I have got my Zosyn here is already labeled. It is clear. The expiration is not expired. I'm going to check compatibility to make sure that I can infuse it alongside the normal saline. And it is compatible. I'm going to gather my supplies and head into the patient's room. Can you state your name and date of birth? Okay. I'm going to perform hand hygiene, and I'm going to don gloves and spike my bag. Hang this right here for just a sec. I'm going to clean the distal port with friction. And connect. The medications weren't compatible. I would just use this as a primary line. Now I'm going to backflow. Make sure I have all the air out. And I do. Put some of this back into here. Alrighty. And I need to lower my primary since this is a piggyback. I'm going to assess the site for any pulvitis and any erythema, edema. All is good. I'm going to adjust my flow rate, which is 6 drops per minute, place my patient in a comfortable position, call bell within reach, and document accordingly.